So, here's the real question. How do dentists like you, who aren't willing to let insurance dictate how you will run your practice, who want to create incredibly profitable practices without sacrificing your time or sanity, how do you create the strategies to ensure your practice not only survives, but thrives in the 21st century? That's the blaring question, and Dr. Steve Schalintz is here to provide the answers. Welcome to Dental Practice Freedom Radio.
Hey, what's up, everybody? Dr. Steve Schalintz. I want to welcome you back to Dental Practice Freedom Radio. And, I wanted to talk a little bit today about something that is continually coming up in conversations that I have, not with just dentists, but my other coaching clients. And, a lot of people are asking questions about ClickFunnels and Russell Brunson. And I know it has nothing to do with dentistry, but so much of what Russell talks about directly applies to dentistry. And he brought up this really important concept, and I think I touched on it a little bit in a previous podcast episode, but I wanted to go in depth on what he feels is the most important things when it comes to taking your business from $0 to $1 million. And I think we could do the same thing in our own practice, saying we're going to go from 300,000 to $1 million or $1.5 million. Like, what are the things that are most important when you do that? And I think the most important things, and Russell touches on this, are the what and the how. And that means, what are you selling and how are you selling it? And I started to think about, how does that actually apply in dentistry? And for some of you that know, for about 2 to 3 years of my practice, and now it's changing a little bit just because I'm in a transition period with an associate and trying to make all that work. But when I was the only one in the practice, and I was there 3 to 4 days a week, I got really ultra focused on the what and the how. And that is, what was I selling in my practice and how was I selling it? So what was my offer? What was unique about my practice? What was different about my practice that you couldn't get from going to any of the 20 other dentists in my small little town? And then how was I able to deliver that in a way that patients could say yes? And I got really, really focused on those two things. What is unique? What am I doing? And then how am I doing it, right? And I know, a lot of you may have read Simon Sinek's Start With Why, and that all plays into this. But I think the more crystal clear you get on the one offer that you have in your practice, the more successful you'll be. And then once you figure out what that is, you're going to find the ability and the ways to be able to deliver on that promise that no one else can do, right? And so it's the what and the how. And if you do those two things, I can guarantee you, if you're a solo provider, especially right now in your practice, and you're kind of like, I really want to be able to take this to the next level. What I see most dentists do is they fall in the trap of trying to do everything, right? So now I'm going to do 6-month smiles. I'm going to do Invisalign. I'm going to do implants. I'm going to do extractions. I'm going to do root canals. I'm going to do all this stuff. And they learn all these different skill sets. And while it's nice to know those things, I don't actually think it leads to more dentistry. In fact, I think it leads to more fatigue and burnout, because now you have all these different things you're trying to implement in your practice, and you're confused and your patients are confused. Whereas if you sat down and said, I'm going to focus on this one thing in my practice, and this is what I'm going to be known for, and I do the other stuff, and if you have patients and they need a root canal and you can do a root canal, great. But that's not how you're selling your practice. That's not how you're selling your philosophy. And so, for me, I'll just give you my personal example, right? So I went through all of this training to learn how to do TMJ rehabilitations with composite. And it was a lot of work, right? And once I figured out that I could do those kind of things, then it became like, how do I actually get this in the hands of my patients? Because this is not to boast or brag or anything like that, but like, my average treatment plan for a TMJ full mouth rehabilitation and composite is about $25,000. And I was thinking to myself, most people, when they come into the dental practice, they're not expecting to pay $25,000 for some type of treatment. So I have to do a fantastic job of creating an environment in my practice so that people know that they have a choice and they get to choose what kind of dentistry they want, and they know what I can offer. See, one of the problems that I see in most dental practices is, like, most patients don't even know what you offer, right? And because you're offering these vast array of services, they really don't know why that's important, right? And I'm gonna probably hop on another podcast episode in the next day or two, talking about how when dentists don't sell the right thing, they don't actually promote the right message. So I'm going to talk about that. I think it's so important that when you are starting to look at the how, right? Once you know your message, for me, it's wellness, it's health, but it's through a very direct route. Like I look for specific ideal target patients, which is mid-50s female, at ortho, probably twice, continuing to have headaches, neck, and joint pain. Like that's my ideal patient. And when I find that patient, I know that like that is right in my wheelhouse. I want to ask you, like, do you have an ideal patient like that? Because when I talk to most dentists, they don't. They just say, well, anybody that values health or anybody that pays, that's not an ideal patient. That's not your avatar. That's not your ideal client. For me, like I'm very specific in what it is that my ideal patient wants. And so when I started to even create my sales message, right, the process that I take to get somebody through, my sequence of events, it's directed with that person in mind. And so it can work for other people. I've had that happen. I have 30-year-old males and 70-year-old males and 70-year-old females that all go through the same process. But I'm not like focused on them as much. I'm focused on that mid-50s female. I encourage you to do the same thing. I encourage you to start getting really focused on what are you doing in your practice? What is your one thing? What is the thing that you know is going to differentiate you from everybody else? And then you create an environment around that. And once you start to do that, the sales actually take care of themselves. Like I've worked a lot with the sales process, right? I mean, I have a program called Dental Sales Secrets, which is an online-based platform to teach dentists how to do higher end services and how to get patients to actually say yes to those things. And I'm not salesy at all when I'm in my presentations with my patients. Like I always, like they have a choice. And most of the time I'm like, well, you get to choose. I don't really care what you do when it comes to, your health, other than to give you choices and let you choose. But I've crafted the environment in a way, and I broke belief systems in a way that most patients now say yes, which it wasn't always that way, right? When I first started it, they didn't say yes. And I knew that I had a problem because I knew how to deliver the service that I felt so passionately about. I just didn't know how to present it in a way to help patients understand how important it actually was, but then they ultimately have a choice. So once you get really, really focused on what are you selling and how are you selling it, and start to look at which one of those two things is lacking in my practice. And I can guarantee you, if you focused on just those two things, you would probably increase your production and your collections by at least 20 to 30%. If you did nothing else, maybe even more. I see it happen all the time. Like the more focus you get in your practice, the faster you will grow. It's a guaranteed thing. People will find you. They will figure out, oh my gosh, I resonate a lot with this message. This office fits me. The insurance questions start to fade away. You don't get nearly as much of that. Yeah, you'll still get it. But I mean, I'm a completely fee-for-service practice right now. And I can tell you that, patients come to me, like they don't really ask the insurance question anymore, which that was not how it started. And I know that's just something that a lot of dentists struggle with, which is, can I only do what the insurance covers? Like, how do I answer that question? And if you set up your process in the right way, that question will become less and less prevalent. So focus on those two things. What are you selling? How are you selling it? Really be honest with yourself. Do I know what my core offer is? Do I know what I want to provide for my patients? And if you don't have the answer to that question, that's the first thing you have to do. And then once you have the answer, then you have to figure out, how do I actually present this in a way that patients can say yes? So hopefully you got some value out of that. And I'll see you at the next episode.
Thank you so much for listening to this episode on Dental Practice Freedom Radio with Dr. Steve Schlintz. We'll see you on the next episode.